All right, so today we are going to be palpating the cervical spine, bony anatomy, and then the soft tissue anatomy of the cervical spine on our patient here, Ryan. We're going to start with the external occipital protuberance, which is going to be the back of his skull. It's the line just above the hairline here. We got a bony prominence right above the back of the skull. So that is our external occipital protuberance. From there, we are going to come to the midline, add the external occipital protuberance with our fingertips, and come just distal to that. The first bony projection you're going to feel is going to be the C2 spinous process. So, spinous process of our C2 vertebrae. We will not be able to palpate C1 because it does not have a spinous process. It has a posterior tubercle that is deep, and you will not be able to palpate that one. Below C2, we can move on down, and there will be a little gap, and then you can find the C3 vertebrae. So here's the C2, here's a little gap, there's C3, there's another little gap, there's C4 below that, another little gap, C5, then C6, and then C7 here, which is our vertebral prominens. That is the most prominent cervical spinous process. So that is spinous processes from C2 through C7. The next thing we can palpate here while he's laying on his stomach is the transverse process. So the transverse process is going to be the side of the vertebrae. And in the cervical spine, they are going to be at the level of the spinous process. So if you find the spinous process and come lateral in line with the external auditory meatus, that's where the transverse process is going to be. So you have to shift the muscles out of the way a little bit, shift the sternocleidomastoid out of the way. And if I am at C2, that transverse process is going to be in line with the ear and at the level of C2. So I'll sink in through the soft tissue and I am on the transverse process. If I push here, I can feel the spinous process moving away from my hand. That's how you know you are on that transverse process. Same thing, I could go down to C3, come in line with the ear, push across. I can feel the spinous process move away from my hand. Same thing, down to C6, spinous process, transverse process. As I push here, it moves away from my finger. So that's how I know I'm over that transverse process. So we've got the external occipital protuberance, all of our spinous processes, all of our transverse processes. While he is still here on his stomach, let's palpate some of the posterior musculature. So attaching to the external occipital protuberance is going to be the most superficial muscle of the back of the neck, which is our upper trap. Upper trap is going to go from this superior nuchal line, is what it's called, down to the lateral third of the clavicle, the acromion process, and then the spine of the scapula. And then there it becomes the middle trap, and then it becomes the lower trap. So it's covering this whole area. At the neck, what that's going to do is extend the neck. So if Ryan will lift his neck up off the table, upper trap is going to be contracting and then relax. Or acting on the shoulders, we can have him shrug up. So if we lift his shoulders up, shrug up, that's our upper trap. And relax back down. Next muscle we can palpate here posteriorly is going to be our suboccipital muscles. So suboccipital, below the occiput, those are going to be below the external occipital protuberance and above the spinous process of C2. So there's a gap here in between. So they sit in that gap. Some of them will run north to south. Some of them are running diagonally. And those are going to extend the OA joint. So they're just going to give that last little bit of extension. So if you'll extend your head, Ryan, just at the OA joint, not here, relax down, just like nodding back. There you go. So right there, that's going to be those suboccipital muscles. Last one posterior here, we have the levator scapulae, which is going to go from the superior angle of the scapula to the posterior portion of the transverse process of the upper cervical spine. So here we have our scapula. Relax, or yeah, lift your arm up. We got the scapula here. If we palpate the border of the scapula all the way around, we get to the very top portion called the superior angle. That levator scapula is going to originate there, insert onto these transverse processes, and what it will do is it will extend the neck, but also laterally flex. So bring your head back in this direction. So lift up and then back. Here, lift up this way. There you go. So it's going to do that. So we'll resist it by having them lift the head up. It will extend. It will also laterally flex. Okay, so if you'll lay on your stomach, we'll get to the rest of these. Sorry, on your back, we'll get to the rest of these. Get you comfortable there. All right, so bony anatomy wise, in this position, we have the mastoid process is going to be just below the ear. So that's the big bone on the bottom of the skull, right behind the ear. From the mastoid process, we can come anterior to the jaw, the mandible bone. So we have on the mandible, we have the angle of the mandible, the mental protuberance, the mandibular condyle, and then here is going to be our temporomandibular joint, 1 finger width in front of the ear. So if you'll open, close, where that movement is happening is going to be our temporomandibular joint. And last bony palpation landmark for the cervical spine is going to be the transverse process of C1. C1 transverse process is really wide, going to be just under the mastoid process. So we'll find the mastoid process, come just inferior to that, and that is where that transverse process will be. That's a bony anatomy. The rest of the soft tissue anatomy, we have the temporalis is going to be in this temporal fossa right at the temple behind the eyes, and that muscle is going to cause occlusion of the mandible. So you'll have the person clench your teeth, and it is going to contract under your fingertips. The masseter is going to be a muscle of mastication as well. It goes from the mandible up to the zygomatic bone. If you find the angle of the mandible and come up, it's going to be right on the side of the jaw. It does the same thing. So it will cause contraction, or it will cause occlusion. You'll have them squeeze their teeth, and then it's going to contract under your fingers. The scalenes are going to be muscles on the side of the neck. They are going from the first and second rib up to the transverse processes of our cervical vertebrae. So they're going to be in this area, behind the sternocleidomastoid, in front of the upper trap. So they are right here in that little triangle. What those are going to do is those are going to side bend the neck. So if you'll bring your head back to this direction, those muscles are contracting when we side bend the neck. Sternocleidomastoid is going to go from the sternum to the mastoid process back down to the clavicle. It will side bend to the same side, rotate away. So if you have them lift their neck up in that position, that is our sternocleidomastoid muscle. And that is all the palpation landmarks of the head and the cervical spine.